activating the PPAR gamma is very helpful already in mitigating the root problem of the type 2 diabetes, which is what we call insulin resistance. PPAR agonist then is able to stimulate your insulin receptors no matter how little they're left to really open up the cells to become more receptive to the glucose. So it's almost like hitting two birds in one stone. One, I control the blood sugar. No? You have good glycemic control. So number two, I lessen the possibility of drug interaction and drug side effects.
Hi, welcome to Simply Healed by Simply Nature presents Dealing with Diabetes. I'm Jermaine Diaz de Rivera, and today we have a very special guest, Dr. Luis Valencia. He's an internist practicing in preventive and integrative medicine at the Egley Wellness Center. Dr. Luis?
Hi.
Hi.
Good day, Jermaine. Thank you for having me over.
It is our pleasure, Paul.
Thank
Now we have a little topic today, which maybe affects a humongous number of people.
Yes.
Now, basically, what is diabetes?
Okay, diabetes, we call it a metabolic disease. It involves mainly an impairment in the glucose metabolism. So what is glucose? Glucose is the most important fuel of the body. Glucose is utilized by our muscles, by our fat cells, by the liver. It also is an important, glucose is very important for our brain metabolism. That's the reason why I say that diabetes is a metabolic disease because all of these tissues get affected when you have an impairment of glucose. So what do I mean by impairment of glucose metabolism? Glucose, being the fuel, has to go inside the cell for it to be utilized. However, what happens in diabetes is that the glucose is left unutilized. It's left mainly in the blood. And as such, what happens is that you do have fuel, you have the gasoline, but it just doesn't get into the target cells where it's supposed to be utilized. Now, if glucose is left in the blood, that's where you start having the problem because literally what is created is that you have a very syrupy, sticky type of blood.
Malapot.
Oo, malapot. No?
So, Doc, how
And what happens here, just to put it in a simple layman's term, is that the glucose molecule now starts interacting with the proteins around your blood vessels, and that usually the ones that are strongly affected are small blood vessels, and it is here where we see what we call the microvascular or the small vessel affectation, which is the beginning of diabetic complications.
So, Doc, how do people get diabetes?
Okay, first of all, it's inherited. We usually ask our patients if their parents, one of them, both of them, if they have grandparents who were diabetic. So there's a strong genetic factor. However, lately, epidemiologists have noted that there is a gradual increase in the prevalence of diabetes over and beyond the predicted genetic manifestation. And they've attributed this mainly to the impact of poor lifestyle. What does that involve? One, type of food that we eat. Two, level of physical activity. Three, stress. Those are the things that strongly affect now. So this becomes a compounding factor. Let me pause for a while and show you what the WHO has shown as far as that diabetes is concerned. Diabetes now affects about 1 out of 11 individuals worldwide. And it has grown like about a little over a million sometime in 1980. But about 24 or 34 years down the line, we have over 4 million people worldwide affected by diabetes. And so the trend is that there is a gradual increase, in fact, a fourfold increase just across span of about 34 years. As far as which areas or which particular demographic groups are affected, they've noticed that diabetes seems to be more prevalent now among low income and middle income families as compared to the wealthy ones, and it's affecting more the developing countries than those in the developed world.
So, Doc, uh, like me, my tiga Pampanga yung lola ko.
Okay.
Mahilig sa matatamis,
Okay.
mahilig kumain. So, I would presume that I have lots of relatives na may diabetes. Now, but ako naman,
You do.
ako walang diabetes. So, what's
Your
the
family,
symptoms?
your
Yeah.
family has it. Your
Yeah.
family has it.
Yeah.
Okay.
Now, does that mean just because my family has it, automatically I have it? Or do I have some symptoms that I have to watch out for?
First of all, as we said, it's a combination of the genetic or nature and nurture. Diabetes is what we call a silent type of disease that develops
Walang
across time.
symptoms.
It could be as simple as a person. Oh, this is one of the most common complaints I've noticed, especially in Filipinos. They complain about ants in their hands. Or in other words, nilalanggam yung ihi.
Okay.
It's one of the most common most common reports that I'm getting. It simply means, why do ants attack or why do ants feast literally on your urine? Simply because you're already excreting sweet urine. Your urine is sweet, hence the ants look for it. The sugar is there already. And that's one. Number two, one of the more common ones I've noticed is that they feel generally weak. And they cannot explain why suddenly, like if the energy level, let's say, is about 10, suddenly across time, they notice that's gone down to about 6. That's 2. So that's the second symptom. The third one is um, frequent urination, especially at night. That would be the more objective way of finding out if the patient reports to you, doctor, I have to wake up about, I used to like sleep the entire night without waking up to relieve myself. But now I notice I have to wake up about 2 or 3 times every night just to relieve myself. So that is a significant, that's what we call polyuria, increased urination. The other one, and then the last one I would say is quite also alarming, is that when patients report, doctor, I'm not changing how I'm eating, but I'm losing weight. So unexplained weight loss is one other symptom. It's very important for us to find, to strongly suspect rather, that you have uncontrolled or impending diabetes.
Statistics wise, Doc, international statistics, how good or how bad is the statistics when it comes to diabetes?
As I said, prevalence just based on the predicted prevalence based on genetic, how should you say, predisposition or expression is about 5 to 6% worldwide. But right now, the prevalence of diabetes worldwide is approaching about 8 to 9%. And the WHO is saying that this difference between the projected genetic expression vis-a-vis the current state of prevalence is strongly influenced by the lifestyle of the people currently. And when I say lifestyle, that involves maybe the type of nutrition, physical activity, stress level. Those are the things that I would offhand say are the factors that seems to be aggravating the prevalence of diabetes worldwide.
Pero doctor, that's international. Is that a reflection also of the local condition
The
here?
Philippines is strongly following that same track. We belong to the Western Pacific and Oceania group. And what they've noticed is that the World Health Organization, since it's still a developing country, or that area or the region where we belong to is still developing, all these stressors of change in diet, change in physical or decline in physical activity, All of these contribute to gradually increase also the prevalence and incidence rate of diabetes here in our country.
So for prevention, let's say somebody has the symptoms that you mentioned, and how can I, even though if I'm, let's say I'm thinking, baka hindi naman delikado, but how can I prevent it nga ba?
First of all, if you already have, let's say, a family history of diabetes, I would strongly suggest that when you reach about 25 to 30, you can have your blood sugar checked on a regular basis. What is regular basis? At least once a year. You can couple this with what we call the glycosylated hemoglobin. Glycosylated hemoglobin measures a percentage of, remember earlier I mentioned about the sugar combining with proteins? One of the important proteins that it binds to reversibly or pwede sila maghiwalay, no, is what we call the hemoglobin, the red portion, the dark red portion of your blood. There's a portion there where the glucose can attach reversibly, and if your blood sugar is persistently high, let's say for the past 4, 5, 6 years, 6 months rather, no, that percentage goes up. We've used this as a way for us to measure, in fact, the exposure of your blood cells, basically the proteins very important around your blood vessels. We've used this as a measure of how bad or how good your blood sugar is being controlled or not.
Pero doc, as everybody says, prevention is better than
Absolutely.
so how can we prevent it?
Okay, prevention number one, food. There are just three things that are very important as far as not just diabetics. I think it's three things that involve being healthy. It's not. I always use this analogy. It takes three legs to make the table stand. So those three legs are one, nutrition. Two, physical activity. And when I talk about physical activity, it's not just the regularity of your exercise. This involves also the quality of sleep that you have.
Okay.
Okay? And then number three, stress management. Stress management may be, no, that is part of the activity that I believe each and every one of us would like to do that. And then supplements. Why do we supplement? No? First of all, let's accept it. We don't have a balanced diet wherein we are able to meet all the recommended daily allowances for all the important vitamins and minerals that we're supposed to take. On top of that, I would say the quality of the soil has also affected the quality of our food products. Number three, mass production of
Yeah.
chicken, all the meat products.
So, doc, if we confirm that may diabetes nga ako or yung pasyente, how do you usually advise them to deal with it?
Okay, if I may add, no, the trend lately is that we used to think of type 2 diabetes would affect individuals about 40, 50, 60 years old.
Mm-hmm.
Lately, it is affecting people as young as about 20, in your 20s to
Bata.
30s. That's increasing. Now, that population of diabetics is increasing as time goes by, which means it's not just the number, but rather when does it happen? So what we're noticing is that it seems to be happening earlier compared to about 30 years ago when I was starting my practice. It's very different, really very different in terms of demographics is concerned. Going back to the question that
How
you
to
said,
deal
how
with
to
it,
deal
ano?
with it,
Oh.
it has to be a different. I would say it used to be just a doctor's realm, but right now I would say it takes a team for it. Since it's multifactorial, it needs to be handled by a team. And in Egg Wellness Center, what we do is the doctor, yes, is a first point of contact to which the patient consults with, but it's very important for us also to coordinate strongly with that team, a team of people who will take care of that individual, and that involves, of course, a nurse, nutritionist, very important, you know? And then the physiatrist or the individual is able to recommend what would be a good exercise for the individual. Yes, we recommend an, how should I say, an overall recommendation as far as exercises. So yes, you do the aerobic exercises, 30 minutes every day, about 4 to 5 times a week. It's fine. But one thing I've noticed, very helpful also for diabetics to have some form of resistance training.
When you say resistance training,
Oh, even like weights. Why?
okay.
The most resistant, the most resistant, one of the most resistant tissues, you know, to treatment are the muscles. That's the reason why they're the first one to disappear. No, there's such a the weight loss that I mentioned earlier.
Okay, it's not fat that.
No. Absolutely not. It's not that. It's muscles.
Muscles.
It's the loss of muscle mass. You will notice. One of the things I check on individuals who are diabetic is just look at their thinner eminence. Here, this one. But dapat ito matambok eh. Because that's a muscle.
Papatambukin ko yan.
Pag yan lubog, lumiliit na yung muscle. So sometimes I just ask them, can you just put your thumb and your pointing finger together and I should feel it. If I see this sunken, that simply means there's already beginning muscle wasting. That's a simple way for me to check on them already. And when that happens, if you're actually encountering muscle wasting, I usually don't remove any more the drugs. I leave them with the drugs that they are currently using. I don't change that too much anymore, and that's when I become more how should I say, become more stringent as far as the lifestyle change is concerned.
So, Doc, if you don't change the medicine, what supplements do you recommend for diabetic patients?
Okay. First of all, I think it's very important. I'd like to be able to show you that the gut flora is one of the most important things that we need to take care of for diabetics. Gut flora or the microbiota are natural, good bacteria, needs to be taken care of. It has been shown that, I don't know, that there seems to be a disruption of the gut flora among diabetics, and which one comes first, they're not yet sure. That's still in the woodworks. Certain supplements, of course, definitely you need all your multivitamins. And one of the things very important, as I said, is that you need to take care of your gut flora, and you feed this by giving supplements which have high chlorophyll or high agonists that will help further multiply these gut flora of microbiota so that they become more efficient as far as your nutrition is concerned.
So usually, among all the SimplyNature products, what do you recommend?
Oh, just the tablets would be sufficient.
Okay, good. Good.
The tablets would be sufficient because it has been shown that the activating the PPAR gamma is very helpful already in mitigating the root problem of the type 2 diabetes, which is what we call insulin resistance. PPAR agonist then is able to stimulate your insulin receptors, no matter how little left there are, to really open up the cells to become more receptive to the glucose.
Doc Luis, how do you actually treat diabetes with SimplyNature products? What's the protocol or the dosing?
If you already have a pre-existing drug for your diabetic treatment as part of your diabetic treatment, I just start with the tablets. The tablets, 10 tablets, which is the recommended dosage that you have. So that's what I would do. What is the target eventually when I start them on the supplement? If they say the individual is on 3 or 4 diabetic drugs, my target is that perhaps we can reduce it to about 1 or 2 with a better glycemic control or blood sugar control. That would be a good target to look at already, as far as management is concerned. So it's almost like hitting two birds in one stone. One, I control the blood sugar. No, you have good glycemic control. So number two, I lessen the possibility of drug interaction and drug side effects because I've used less drugs. I forgot to mention earlier the interplay of the hormone insulin.
Okay.
Insulin is a very important hormone. It's one of the most important metabolic hormones. Okay, it affects the glucose metabolism, lipid metabolism, protein metabolism. All those things are very important. And what happens in diabetes is that you have actually more than enough insulin rather than you lack. That's for the type 2. And the reason why you have more than enough insulin is that your cells are saying, wala kaming glucose kulang kami ng glucose. So what happens is, so it's signaling the pancreas, which is the source of the insulin, to release some more of it. But the cell doesn't respond to the insulin. So the underlying cause of type 2 diabetes is what we call insulin resistance. You have more than enough insulin, but your body is resistant to it. It doesn't seem to be listening to that interplay.
Wow, that's so interesting. Pero Doc, I do remember that you mentioned that you have you have a patient that was very, very successful.
Okay, that's true. This is when you're trying out something new, I think one has to be a little bit brave, at the same time cautious in terms of trying to. I haven't tried PPARs of SimplyNature for a patient who's into end-stage renal disease secondary to type 2 diabetes. I've tried this of this individual is already about, if I'm not mistaken, is a 65-year-old male. He's 65-year-old male. He's been diabetic for almost over 20 years. He was brought to me December together with his sister. He was brought to me and they were asking me if I could do something for him since he was already approaching or going to have dialysis in a couple of weeks.
If they start diabetes, there's no turning back now.
Yes, that's the reason why I said that this I just felt it was a long shot because I would use the PPARs mainly for prevention, part of the treatment. But for me to prevent or delay a problem that's already there, which is the kidneys. No, kidneys are no longer working. No, they're working very minimal already. Like, just when the patient walked into me, and I knew already he was a renal patient just looking at his skin. It's dark. It's what we call having this uremic cross already. And I was asked if I can do something. So I didn't promise anything. And I decided to start the patient on the capsules, on the gel capsules of SimplyNature. That's where I started. That was December of 2019. And thankfully, it's already November. That patient hasn't undergone dialysis.
That's good.
Yeah. No, I said I've just communicated with his sister, and his sister said, "Oh, he's doing fine.
Okay.
He still hasn't had any dialysis, and his diet seems to be much better."
That's good.
I think what I'm going to add there also is that I guess the way I was able to help him through that product is that maybe through an improvement of his quality of life. I could not reverse. I honestly feel I could not reverse the deterioration of the renal function. However, the mere fact that they were able to delay the dialysis, the patient is mobile, the patient is able to do regular physical, literally just being able to take care of himself. That's already a big deal. At the time when I got the patient, this end-stage renal disease patient, his ECC, or what we call endogenous creatinine clearance, was at 10. ml per hour, where normally for his age it would be about 50, 60 ml. In short, at that level of 10, one more step below that, a little more step below that, definitely is going to undergo dialysis. So that was when I got him, just started him on the PPAR capsules. I was thinking initially of using the liquid, but I had to take into consideration the economic status of the individual. He was a retiree, so rather he is a retiree, and I decided to give him just one capsule of the PPARs once a day. That has been the dosage since the start, and thank God it's been working.
Still working. That's perfect. Thank you very much. That's fantastic. So he did not start as of today any dialysis.
No, he hasn't had any dialysis.
Okay.
That's been going on the 11th month.
And despite and that was a miracle because if it was locked down, paano? How did
So how did
patients
they?
survive?
You know, they were okay. Just to tell you, this patient lives in San Jose, Batangas.
Ano?
They really like the fact that it worked. They would have it delivered.
Okay.
They had it delivered. At the start, they were asking me how to go about it, and thankfully, the wellness center, thankfully we worked as much as possible in assisting our clients and our patients on making it happen, and we did find a way.
Okay.
We did find a way to deliver it to them.
Right now, if you discover that you have diabetes, what type of lifestyle do you actually end up having?
If you are a diabetic, you just have to be more stringent as far as your lifestyle is concerned. So when they say more stringent, I strongly advise that an individual work closely with a nutritionist. So one nutritionist, two definitely is an exercise expert, a physiatrist, a trainer, so that the trainer knows and needs to know that this patient is diabetic. What would be the best one? As I've said, aerobic exercises. A little bit of resistance training is going to be very helpful. A little bit, not too much. I'm not going to make my diabetic become a bodybuilder. The target is really just to increase, just to make the muscles work some more, so that we are able to get over the hump of this concept of what I've said on insulin resistance.
Fantastic. If you were going to give one advice to a diabetic patient, what would that be? Eat healthy?
That's hard for me to say. Not really, just be healthy. I mean, we know it. At the end of the day, we know it. We know what's good for us. We know, and it doesn't have to be. It doesn't have to be a form of nutritional deprivation at the end of the day. I think it's just really making healthier choices in terms of the food that you eat. Oh, by the way, one of the other ways we can help diabetics is that we can see their genetic profile in terms of how their body metabolize or handle food. We do that in AMA. So we do have a gene test where we are able to find out what would be the best type of diet to give you. Not like it doesn't become now it becomes more customized for you and more targeted, more predicted, rather.
Thank you very much, Dr. Luis. And of course, I'd like to thank him for all the information that he's provided us. So that's Dr. Luis Valencia. He is an internist practicing preventive and integrative medicine at Egley Wellness Center. So that's Simply Healed by Simply Nature, presenting Dealing with Diabetes. Have a good day.
I trust.
And I trust.
I trust Simply Nature.